And I'm still a host and all that, so I can still share. Do you want me to go ahead and share now or just wait?
Just wait 1 second. Yeah.
Okay.
All right. So thank you to the few people who have been able to hop on and join us for this presentation. It was scheduled to be a Facebook Live, and then technology prevented that. So thank you for hopping on. We'll still be giving the same, or Dr. Scott, McDougald Scott will still be giving the same incredible presentation. And so we're really excited to have that. Brief introduction. My name is Maya. I am the Communications and Development Associate for WREN, the Women's Rights and Empowerment Network. We are a South Carolina-based network with the mission to build a movement to advance the health, economic well-being, and rights of South Carolina's women, girls, and their families. And we are so excited to have with us today Dr. Almost about to be doctor in a couple hours, Amanda McDougald Scott, who is here to talk to us about what child care workers want to know. So I'll turn it over to Amanda to introduce themselves and give a little hello.
Hey. Thank you so much, Maya. I'm excited that we're able to continue with this presentation today. I've just been preparing for it and am just delighted at this opportunity to share just a very small piece of my research for my dissertation for my PhD. And yes, I graduate today at 5 o'clock from Clemson. With the International Family and Community Studies PhD. So I'm ready to share my work. I see somebody's got a hand raised. I want to, is everything okay? Like everybody can hear and stuff? Okay.
Got it. Congratulations in the chat.
Katie.
And so what we'll do is Dr. McDougald Scott, sorry, my mouth is dry, is going to give a brief presentation on all of the research that she's done and compiled. And then as the presentation goes on, please put questions in the chat or the Q&A section so that we have the opportunity to answer them, or Dr. McDougald Scott has the opportunity to answer them at the end. So all questions will be answered. Please contribute as much as you possibly can, because we want to know what you want to know. We have an expert sitting in front of us and we really, really want to learn. So without further ado, I'm going to go ahead and turn off my screen, and you can go ahead and share your screen so that we can get the presentation started.
Awesome. Thank you. Okay, let's go. Okay. So I just wanted to remind everybody this is just a very small sliver of the research that I've been doing, but it's a very, very important sliver, if I do say so myself. But I say so because this is one of the only studies that actually really highlights the everyday lived experiences of child care workers, and it is the only participatory research action study that I have found in my extensive searching. And so it's wonderful to have worked together with child care workers to design this study, and then with the understanding that this study didn't just stop with my dissertation or the work that I was doing at Clemson or even before that, but they will continue and we will take action together. So this is just one piece of that. And I want to start with this wonderful picture, because to me it really demonstrates and really gets to the heart of what I'll be talking about for the next few minutes. And that is that love and commitment that child care workers feel for children that they work with. This is a picture of right when COVID started, and my son had just come home from the hospital, and his teachers came by to say hi to him, and it was just wonderful. So let's keep going. And just a brief introduction. I'm trying to hide this little thing at the top. I'm just going to forget it's there. Okay, so this is a chart to just show the child care worker pay in comparison to other similar professions. But just really briefly, I wanted to share that child care workers are underpaid, and they have a lack of access to employment benefits, which can cause personal workplace and interpersonal stress. It contributes to child care quality issues. It has persisted for at least 5 decades, and it disproportionately affects childcare in comparison to other workforce sectors, which again is the reason for this chart. We can see here in South Carolina, the child care provider median, or that's really a teacher's salary, is about $19,480 a year, and that is not a living wage. So systems change is needed in order to improve the wages and the access to benefits for child care workers. And society and the elected officials can improve the US child care system together. So I just, again, very briefly give a little background information. I was very deliberate with the selection of who was going to be in the study because I wanted to get a really good representative group here. We had 13 women and 1 male, and 4 African American or Black participants and 10 white. We had a mix, as you can see here, of family child care homeowners, center directors, teachers, associate director, and we had some who accepted vouchers in their centers and others who did not. And we also had one person who described herself as a teacher and a training and education coordinator. She had kind of been promoted. So what child care workers told me in response to the question that I really wanted to know, or one of the questions that I really wanted to know in my research, which was what child care workers want others to know. So we don't want to just presume that they wanted to talk about any one particular, thing or push them into a box. I really wanted to know, what it is that they wanted us to know. What did they want society, family, elected officials to know, and not to decide that for them? And so I got some surprising and some not surprising answers here. The number one answer that they gave me was that childcare is rewarding. And I was a little surprised because I thought they might go in a different way with the answer to this question, but I was very delighted to hear their stories about how rewarding it is. And so here you see the list of the things that they told me that they wanted others to know. And I'm going to dive a little bit deeper into each of these themes. Some of them are combined because they kind of overlap a little bit, but overall, this is what they wanted us to know about. So first, we'll start with rewarding. Like I said, all child care workers wanted people to know that they love children, and that's why they do the work that they do. And so here's a quote from Grace, who was one of the directors, and I'll just note that these are all pseudonyms to protect those who didn't want to their identities to be revealed. But we'll have hopefully a future panel where some of them actually will be participating. But this is just a quote from Grace, who is a director of a center that, again, that's why they do it. They love working with children. They also make significant time investments in children and families to do the work that they do, and time investments in some training and things like that. They also make personal sacrifices. If you're living with low wages and the lack of benefits, there are gonna be sacrifices that are made there. And they are very committed to their work. And that's why they continue to do it too. They really feel rewarded by their interactions with children, and that they're doing all of these things so that children can grow and learn in developmentally appropriate ways. So they also all emphasized, all the child care workers in the study emphasized how important their work is. So I just wanted to re-emphasize that the child care work requires training and professionalism. And the training that they take and undergo, which some of it is required in South Carolina, and I know in many other states, but their tools, the training really provides them with the tools that they needed to develop and implement developmentally appropriate curriculum. And they shared this as well, that they felt that this was an important part of what they were doing each day, and that training really helped them with that. But one obstacle that needs to be noted is that there are many organizations that actually do help teachers get the training that they need, and help then centers who help provide that training It also can really be an obstacle for childcare providers who, when they have to pay for this training and they may or may not know about resources, or the resources that are available change a lot. And so there's a lot of additional information about this topic that I could go into, but I need to get to the surface here. But basically, one of the main points I wanted to bring up with this was also that if they had to pay for their bachelor's or something like that, that was going to go towards this training for them to be in the childcare industry. The wages that they're making really don't allow them to pay those student loans effectively, and so that becomes another burden. So let's go back to the fact that the training and the professionalism is critical to optimal brain development in children. And that's one of the reasons why it's so important for them to continue that training. Now, some examples of how it is critical for this brain development is that there's meaningful interpersonal interactions that happen each day between the caregivers and the children. And this is rewarding for both the children and the caregivers, I should say. A lot of people don't realize that the caregivers are also teaching early math and science and reading skills. And, many parents, and any of you who are on this call who or on this webinar who have children in childcare, the children bring home projects and stuff. And that's just evidence of the interpersonal interactions and the teaching of some of these academic skills, but also life skills. And a story that I want to highlight about the life skill, which is the reason for this example about the chip dipping, is that one of the participants gave me this lovely story about how one of her colleagues had just come in all distressed because she said, all I did today was tell people to stop and to sit down and wipe noses. And I'm just so dejected. I didn't get to teach them anything. And so the participant told her colleague, well, you probably did teach them something today, right? Did you teach them not to dip a chip in the dip again after they had already done it once? And then she said, well, yeah. And then she said, there you go. You taught them something. So I just think that illuminates the important work that the child care workers are doing each day. So here's another really important finding. So first of all, child care workers want respect because they feel like they are not getting it from really anyone. So that is very unfortunate, to say the least. And so one finding from the study that I have not seen anywhere else in the literature is that child professionals are actually feeling stigma in their profession. So again, that's a topic that could be a whole nother webinar, but I wanted to point out that the definition and why this is actually stigma, and the evidence that was there in the interviews is that society perceives childcare workers as less important, as their work is less important, easy, unskilled, or just babysitting. And then people were actually telling them, according to the interviews, that they do not have a real job. And here is an example of that from Natalie. She was just talking about how some people just see it as something that she was doing until she did something else, but she really feels like nanny is her profession. And several participants reported that they were being treated as servants. So this is all different aspects of stigma. So childcare workers are not being paid a living wage or being provided benefits, as we've already touched on. But here's some of the things that they're concerned about, the caregivers. It's the making a living wage, the benefits through their employers, the lack of those. They told me that the benefits would help them immensely if they could just get, health insurance through their employers or through another means. I have some ideas about that. They were also worried about the long-term viability of staying in the field that they love. I mean, they were really sad when they thought about having to leave the childcare industry, and I was sad too. They were willing to stay even with the low wages, and they were also concerned about the quality of future childcare professionals. This came up several times, and the childcare workers were concerned about their own ability to stay in the field, and those who were able to stay regardless of the wages were worried about their colleagues who would leave because of the wages. And they also indicated that this quality was being compromised because they couldn't really see the benefits of doing the additional training and being, a child care professional if the reward in the wages was not going to be there and keep attracting people to the profession. So this highlighted quote from Jasmine, who was one of the teachers, has actually come to childcare from the business world. And this is a really poignant quote because she's making the comparison that we in the business world put our money where we find the value. So in professions in the business world or with titles that people see as more prestigious, you can often point to the salaries as an indicator of that prestige or importance. But in with childcare workers, as I showed at the beginning of the presentation, you're just not seeing that investment and that indication of value in the wages. So childcare worker, this was another kind of surprising finding for me at least, was that they wanted to talk about the burden of administrative work. And Bethy here, one of the directors, was complaining and saying that she had been around and around talking to different people about the amount of administrative work that she had to do. And she was very concerned because she said, look, I mean, these people are going to maybe get paid $11 an hour. You're asking them to do a bunch of additional tasks and go to the doctor and get checked out and pay for their own fingerprints, etc. It's like 3 or 4 weeks before they can even come to work. So that's just an additional burden that's placed on even entering the child care field. Now, this is another one that I really, really want to emphasize, and that is that childcare workers did not feel valued and lamented the fact that they were not classified as essential during COVID. So childcare workers and the work that childcare professionals do has been important before COVID. But as many of us know, COVID has really shined a light on the importance of childcare and the lack of infrastructure and support and financial support, societal support that caregivers have been receiving for a long time. And so this came up several times in the interviews. What also came up, which I can also shout out to ICS's report on child care centers and what they found about centers closing, as well as NEAR and a couple of other organizations. But childcare workers in my study were weighing safety concerns, finances, and enrollment declines in their decisions about whether they were going to stay open or close. And so some of them told me about like laying off some staff, and some of them actually consulted their attorneys and were advised to close because they weren't sure about mitigating the risk that was going to be associated with staying open or providing care. Now, before the pandemic, as well as now, childcare workers also allow others to get to work, and they are really that economic and societal backbone of our society to allow everyone to be able to get to work. And they continue to do this in the face of potential danger during a pandemic. And so what they were telling me also is that they're relying on the families of the children within their care to practice safety precautions so that they would also be safe. And this is especially important because they're living with lower wages and lack of access to employer provided healthcare benefits. So in conclusion, I would just like to say that I think one of the solutions is going to be a societal one, particularly when we consider stigma and we see the response to the American Families Plan that's going on right now. So I think that childcare, and we think, it's not just me, it's also other childcare professionals in the study, that childcare professionals would benefit from society having a better understanding of the essential and professional work that caregivers bring to their jobs each day. And so from our standpoint, our children, families, community, and society would benefit from a campaign that would actually help others understand the work that child care workers are doing each day. If they don't understand that there's actual teaching and life skills and that kind, and a lot of training and professionalism that's going into this work, they're just not valuing it as much. We also need to use this campaign to, with the overarching message that this work is professional and trained and skilled. Um, Hopefully that will also lead to an improvement in the way childcare professionals are treated. And then it will also support the policy changes that are needed to support the childcare workforce through better pay, access to benefits, and less administrative work. And then everyone will know that childcare workers are essential. So we have to take action. It's time to listen to childcare professionals. It was time to do that over 5 decades ago. And what we need to be doing now is showing them that we are listening by taking action today. And so Catherine here highlights that she thinks that people have no idea the importance of childcare work. She feels like the government leadership doesn't understand it, and that if they would put their money into it, that the society benefit in 10 years would be improved. And she just thinks that the leadership thinks that childcare workers are kind of making up the impact that they have on society. And I mean, I kind of think they're right. I think we do need improvement. So here's the question and discussion part. That's my son. I hope y'all enjoyed lots of pictures of him today. And yeah, I'm here for any questions.
Thank you so much. I think I learned a lot from that as
Oh,
well.
good.
Courtney said little suit. It's so cute, little seersucker. So if you have any questions, please put them in the chat, or if you'd like to verbally ask them and you want to, you can just click the raise hand function. And that way we can call on you and you'll be able to ask by voice. But it looks like we have one in the chat right now. Courtney asked, in your interviews, were you able to hear from caregivers about how their own families have fared during the pandemic? Extending the question, they're taking care of other people's children. Does their pay allow them to take care of their own?
That's a really complicated question. And so I'm going to first say, yes, they did talk about that. There's a significant burden on caregivers' families because that was one of the reasons that I did this study and asked the questions that I did about their everyday lives. I mean, I think a lot of people in society and the community and families are not thinking about is that these caregivers are giving care to their own families before and after their caregiving job that they're paid for. So this is going around the clock, and a lot of them experience burnout when they get home, and they feel like they're not able to provide really the same level of care for their own children. And the burden, of course, of not making a living wage and not being provided benefits also affects their children in the way they're able to care for their children.
Awesome. Thank you.
And some caregivers also express concern about taking COVID home to their children.
I would imagine. Any other questions people have, please make sure you put them in the chat and raise your hand. I have a question. You mentioned briefly during the presentation that care workers often don't get benefits, and then you said that you had a couple ideas on solutions for that. So would you expand on that?
Yes, so first and foremost, I do think that childcare workers wages should be increased, but that's very complicated. So to answer the second part of the question about specifically benefits, Medicaid expansion has not been approved in South Carolina, and Medicaid expansion would help to provide health care benefits to child care workers. So even if South Carolina did approve Medicaid expansion, it still would need to be up to a 200% of the federal poverty level in order to really provide coverage for a lot of the childcare workers at the median wages that they're receiving. And then in states that continue to decide that they're not going to expand Medicaid, they could also apply for a Medicaid Waiver 1115, which would they could specifically say that Medicaid provision would be for childcare workers. And so at least then we could offer a benefit that would help bolster the quality of life and in some ways also bolster the income of childcare workers.
Seems like a pretty simple solution to a problem.
There are other benefits as well that childcare workers wanted, but that's a whole nother presentation.
Well, maybe we'll bring you back on for another one.
Yeah.
We have another question from Jasmine asking, what's the most important thing that we can do as parents and advocates right now?
There's a lot of important things. Thank you, Jasmine. I really think, oh, am I still on?
You're still on. I just popped off the screen share so that people could see your face better.
Oh, okay, great. So really supporting the family. I think the American Families Plan is a really great start. The American Families Plan is not perfect, and there are still things that need to be added and details that need to be worked out. And unfortunately, there's also some pushback that's along partisan lines to different pieces of it. But I can say that it is very popular. If you just take the partisan lens out of it, many pieces of the plan are popular. And so I know people, may get a little tired of being asked to write their representatives, but I do think it's important to remind our representatives that these are important policies that really, really help not just childcare workers or any one particular segment of society. It helps everyone. Like I was saying earlier, the importance of childcare work and that important training that they put into the development that benefits the children, the families, and the employers. So, I always say kindergarten readiness is workforce readiness. It's readiness for families and children and employers, and that's why. And so, just pushing and advocating for the provisions of the American Families Plan is a really great place to start. And then on our state level, we can also push for some of the same ideas and remind our state and local legislators that those should be our priorities. And then we can go further too, but I think if I was going to prioritize anything right now, that would be it. And also letting people know about what childcare workers actually do. Yes. I see that question. And that was where I was going with my last comment. So thank you for that, Ashley. That's exactly, yes, that is what I was going to say. The stigma part is powerful. And that's why the campaign that I'm advocating for is so important, because it's not just talking about writing your legislators and why it's important at a policy level. It's really creating some of that like grassroots societal change, because people continue to see childcare workers as they put it in their words, that people call them servants or just babysitters, and not recognized or appreciated for the important, valuable, critical, professional work that they're doing for children and families every day. I just don't, it's going to be harder to create that change on a policy level because people just don't understand.
That makes a lot of sense. Stigma can be very, very powerful. And we need to be working to change that. I think we got time for one or two more questions, so I'll keep that space open. But while we wait, if there are any more questions, is there anything else you'd want to expand on or share, any key points that you want to make sure are highlighted in this presentation?
Gabriel
has a question. Can you speak on opportunities for larger businesses to include child care centers at their locations?
So that is a little bit state dependent. So in South Carolina, there are some tax credits and benefits for for businesses to support childcare and to have a childcare within their business model at their on-site. Now, I don't know what the law is or the tax credit availabilities are in every state, but I do think that that is one of the critical solutions as well to increasing access to childcare. And that was some work that actually I started on some work a couple of years ago with the chamber for that very reason. Um, so the next question was, would workers be interested in those arrangements? Um, I think from what I've seen that there is interest in those arrangements. It's kind of from what I've seen, the parents who are able to take advantage of those opportunities really value it because during the day they can also kind of go visit their children. And I know that my son is still small, but just before, COVID and everything, just being able to visit him during the day was a big deal for me. And so in the business situations where there is on-site childcare, I think it greatly improves the quality of life for employers, and employees. So I think it would have to be a little bit about quality and availability and space, that kind of thing. But I definitely think it's valuable.
Awesome. Okay, so in attempts to keep to time and make sure we're not taking up a ton of your day and so you can go celebrate your graduation, I think we'll wrap it up there with questions and answers. But I want to say thank you so much for hopping on and joining us and sharing your infinite wisdom. If anyone wants to learn more about this topic, Dr. McDougald Scott actually wrote an incredible blog post that's posted on our website, scren.org. You can go to the blog section, it'll be right there, going into even deeper detail on all of these topics, all of these issues. And I learned so much reading that blog, and I hope everyone takes 10 minutes to go read it because it really, really does expand on these issues.
Thank you.
But unless you have anything else you wanted to add, I think we'll wrap up here.
I just quickly wanted to thank the people who, I wanted to thank Ren for this opportunity to share this sliver of my research, and it is a very, very important sliver. And I also want to thank Clemson and my dissertation committee for supporting this, as well as all the child care workers who have been doing this work with me. And First Steps of Greenville County and the Palmetto Shared Services Alliance for helping me recruit participants.
Awesome.
Thanks.
Well, thank you for joining us and have a wonderful rest of your day.
Yeah, thank you. Thank you.
Bye.
Bye.